Hello and welcome to the Functionally Enlightened podcast with Dr. Sharon Surita. We interview well-respected medical and functional practitioners, as well as patients who have overcome disabling chronic conditions, such as dysautonomia, and reclaimed their health. These enlightened guests provide helpful tips on managing chronic pain and illnesses, using a combination of traditional and whole-body healing modalities. If you're interested in natural healing and quality of life improvement, you're in the right place. Thank you for listening to today's episode.
Good afternoon, Functionally Enlightened friends. On today's episode, we're going to review one of the foundational labs we like to use. It is the mucosal barrier assessment. It is a key lab or key diagnostic screening that gives us a little bit more insight into, again, the gut health. We've talked on other episodes about the GI map. We talked about the stress and hormone profile. So this is one of my favorite ones. It is pretty quick, simple to do at home, and gives you three precise indicators or three analytes that can fill in the gaps to knowing exactly what's happening to that mucosal barrier or that gut integrity. So when we are going over it, and for those of you who are watching on YouTube or watching the video, we are going to be sharing a couple of diagrams that will help you get some information or get some insight as to what the mucosal barrier is, where it's located, and also those parameters that we're going to be reviewing. I'll share with you I'll share with you a client's results and keep it, of course, anonymous and HIPAA compliant. So when we go over it, you will see what the actual lab will look like. So again, as an FDN, we look at the hidden system or the hidden methodology. And what hidden is the acronym. It stands for hormone, immune, digestion, detox, energy, and nervous system. So all of these systems in the body are looked at collectively and utilizing the labs or the screenings that speak well together. And we use various parameters that will give us the whole picture, a nice picture of your entire body. So again, hidden is the acronym for all of those systems. As always, when we look at a protocol, we're going to look at those 5 pillars, and these are essential for any protocol that we develop, anyone who's really working on their wellness journey. They include diet, rest, exercise, stress reduction, and supplementation. Those are our 5 pillars. And with diet, that one is first and foremost very important. And we talked about the MRT, which was the mediator release test on a prior episode. And that one, we really dove into those food sensitivities and how they can impact your immune response. We also looked at the metabolic typing diet and honed in on the fact that everyone's very bio-individual. There is no one-size-fits-all approach, especially in diet. We've all tried multiple different types of diets thinking, yes, we have to stick to this one to the T. And that's not necessarily the case, because in every diet, there might be some food triggers within them that we don't really know about until we try them out. We can eliminate some of those things from the diet that we know we were past reactive to. And that's the only way really to work through these. But when we look at it, we look at the whole picture in terms of your metabolic type and any food sensitivities that might be triggered. We don't look at things that you would have to challenge. It's the whole blood test that's analyzed. So the laboratory will take, it depends on the test that you select, but I believe it's 176 foods that are tested. So again, the MRT, we look at the diet, we eliminate things that we know are triggers, and we learn those hidden triggers through that MRT test. Now going on to rest, we're going to talk about, when we look at rest, we look at more than just your sleep hygiene, even though that is a huge, huge part of it. Resting your 7 to 8 hours per night, getting that 8-hour window in the absolute best time range. So we aim to be asleep by 10, wake up around 6, and consistency there. All the rest of the good hygiene that you would want in your room, no electronics, no blue lights after a certain hour, nice cool room. What else? You want to be comfortable, of course. Some people sleep better with socks because the feet get cold. All those things come into play to develop the best rest protocol for you. Exercise, we've talked about that being a stress. It's a eustress when done correctly, and it can cause distress when done incorrectly. So some people they want to work out 6, 7 days a week and they wind up overexerting themselves. We don't need to do that. We need to find the optimal type of exercise, the frequency and duration and intensity. All of those things are super important to determining optimal amount of exercise. Stress reduction, along with rest, those two can kind of tie in together because in stress reduction, we also want to find periods of time during the day where you can pull back and take a rest moment. That can be a 15-minute meditation practice, a leisurely walk in the sunlight outdoors away from your workplace, whether that be behind a computer screen or if you're doing physical activities, maybe finding a nice quiet place to do the unplugging of whatever physical, mental, emotional things are going on right now. And so we call that also rest. You're resting from that work environment. And it's ideal to do this at least 2 times a day, 3 times if practical. And it's a good idea to do it first thing in the morning to get you started off on the right foot. And right before bed, you can do it in the form of a gratitude journal, which is very, very helpful. It's been proven in the research, and it will help you shift your mindset into a more positive one. And then the last of the pillars was supplementation. Supplementation is just that. We supplement the things that are deficient or out of balance in the body. And none of that can be determined until we do a thorough review of the lab screenings. Well, as we move forward, when we talked about hormone last time, there were various stages in this cortisol dysregulation. And if you're watching again in the green, the first one highlighted here is adaptation, known as homeostasis or balance. That's where we want to be ideally. And not too many people stay within this zone until they learn how to adapt and how to manage their stress so that it's always a eustress. It helps us to grow rather than it causes us to burn out. But more than not, I do see people approaching an acute distress level, and that is the next phase when their body is trying to keep up by producing more and more cortisol. And they are successful at that in the first half of this curve or in this phase. Usually you'll feel even better because your body's able to produce that cortisol before you start losing the ability to produce that. So you think that's where it feels best and healthy, but actually we want to tone it back to that homeostasis or that balance. Maybe it's not feeling as much energy or, as much drive, but it's a balanced drive, and we always aim for that balance. Beyond that acute stress, when your body stops being able to produce the cortisol at a reasonable rate, and you start developing what they call sometimes adrenal fatigue, your vital reserve is depleted, and that leads to a chronic distress. We call that the compensatory phase. So we go from normal to acute to compensatory. And even at that, if nothing is done to correct the problem, then you get into the exhaustive phase. And that is when, not necessarily when people die, that's a little bit morbid, but actually when your body can no longer build that reserve and you feel that fatigue all day long. Very difficult to get back out of it, but it is possible. You can reverse this trend and get back into balance or homeostasis. Now, the meat of this talk is on the mucosal barrier. Maybe you know what a mucosal barrier is, maybe not, but in essence, it's everywhere the inside world meets the outside world, or vice versa, where the outside world meets the inside world, and then it comes back out. So when you think about mucosal barriers, we think of eyes, nose, mouth. We think of the reproductive area. We think of the GI tract, but a lot of people don't realize that the small intestine would be considered a mucosal barrier as well. Yes, it's mucus lined, right? We have mucus production inside. And why and how does it meet the outside world? Well, whatever we're consuming. So it goes through the mouth, the esophagus, the stomach, and then it gets into that small intestine, which is what we're going to really focus on with this mucosal barrier test. And then, of course, it's going to follow through the large intestine, the colon, and then exit through the rectum. So it will eventually go out. And that's the goal. Like food comes in, we absorb the nutrients and what we need from it. And actually, it's a very small amount, a small percentage that we absorb. And then everything else comes out as waste product. That is the way the body's supposed to work. So when we're looking at the mucosal barrier, this diagram is really helpful because it shows the inside of the small intestine. For those of you who can't see this video right now, the small intestine has on the inside a fold called it's the intestinal lining. And within that, it has some finger-like projections called the villi, and then some hair-like projections on top of that called the microvilli. And imagine these things floating around inside your gut lumen, that hollow tube of your small intestine, and they're waving around, picking up all of the nutrients that they can, attaching, whatever atoms are coming through, preferably the healthy ones, and allowing it to percolate through that gut wall at a slow rate enough to absorb what is needed. But we have issues when we have some damage to that inside wall. And that's where this test gives us a good idea of what can be the issue. So as we look at this diagram, I imagine everything coming in. And then when we study the GI map, we did learn about gut dysbiosis. You can think of bad bacteria kind of crowding out the good bacteria, and they're taking up residence here on top of this villi. So they can munch away at those enterocytes, which I'll show you in just a moment what they look like. They'll munch away on that. They will break down or blunt down that brush barrier, and then they can cause holes to form within that. Now, this diagram is a better one to show you just how sensitive that system can be. So again, for those of you who are not watching, there is a single cell thickness membrane. These enterocytes are lining the gut wall. And if they become damaged, nothing preventing toxins from coming into our bloodstream on the other side of that wall. And on the inside, again, we call that the lumen. On the other side is the lamina propria. So this is where the other two parameters that we're going to talk about come in. The three parameters, actually. We have zonulin, it's a family peptide. We have histamine, and we have diamine oxidase, an enzyme, which is referred to as DAO or DAO, however you want to say it. Imagine that you have some food particles with some bacteria or some type of antigens coming into your small intestine. And if that single cell layer is disrupted, then you have things like those, then you have bacteria chewing away again on those villi. They can make holes in those tight junctions. But at the same time, when they come through on the lamina propria through those holes, the response is for your body to develop this histamine. And so histamine is produced. It's a response that's intended to be there to basically encapsulate any of those toxins that are coming into the other side of your gut lumen into the lamina propria. So the histamine will encapsulate these toxins, and then zonulin will come in and open up those tight junctions again to flush that stuff back into the small intestine or the gut lumen. Now, the idea, again, is for it to continue its process passing through the lumen or through the small intestine and then being excreted in feces. What happens is, because there are so many antigens passing through, or people are developing food sensitivities for the very same reason, that zonulin is continuously opening these junctions, increasing the amount of time these junctions are opened up, trying to flush that back out, doing what the body is intended to do. But if you keep on, antagonizing it with these triggers, then we have an issue. So that's on the lamina propria side. Now, bouncing to the lumen side, on this side, again, think about damage being done to the villi and the microvilli. That's where, in those crypts of the villi, is where our enzyme DAO or DAO is produced. And if there's damage there, then the brush barrier is blunted down. You're not going to be able to produce those enzymes as effectively. And the role of those enzymes is to break apart that histamine bubble that we saw coming through. Remember, the histamine bubble tries to capture those toxins and then push it through. Well, DAO, once it's through, is going to come through and break that histamine bubble down and help to flush what we don't need out of the body. So we have issues when there's an imbalance there, just like with any other screening. Now, this diagram shows when we have an issue called leaky gut or hyperpermeability. So if we look again, we have microvilli or the brush border at the top. Those things become impaired. The tight junctions begin to open. And on the diagram, it's nice to look at what a normal tight junction is supposed to look like. And then where we have transcellular penetration of antigens, paracellular penetration as well. And one of them obviously is, we don't want that to happen. Transcellular is breaking through the cells, and then the paracellular is between the cells. And in this case, where you have leaky gut, both forms of entry become kind of overwhelming to your system. And so when we look at the circulating immune complex, then we can see things like nutrient malabsorption happening, autoimmunity, food intolerances. Also, think about this being a systemic problem. It can potentially be happening to every other organ system in the body, including the brain. So think about the blood-brain barrier breach and how the ramification behind that can be neurological. Those symptoms can present themselves as depression, anxiety, and ADHD when they affect the brain. They can present as skin issues, acne, rosacea, eczema, psoriasis. They can present as thyroid issues, so Hashimoto's, hypothyroidism, Graves' disease. In the GI tract, you can already imagine some constipation, diarrhea, IBD. In the hormonal system and adrenal system, you can experience chronic fatigue, adrenal fatigue, things like that. In the joints, you might experience severe joint pain, rheumatoid arthritis, fibromyalgia, headaches even. And in the sinus and mouth, which are your other mucosal barriers, you might develop frequent colds because of reduced immunity, and then food sensitivities continue to be compounded. On this last slide that I was going to show, this is an actual lab result from a client. And for those of you who can't see, I will tell you what the values are and where we would like to see them. So the first parameter is zonulin family peptides again. This is the thing that opens those tight junctions and tries to flush the bad stuff back out of our system. So we ideally want to see it in the first quintile, which is between 0 to 7.8 here. And anything above that can essentially be referred to as leaky gut. In this case, it says borderline, but again, we're already approaching the third quintile with this client. And that means that we need to really work on that gut integrity. We need to think about diet more closely. We need to think about what else is possibly entering the system that possibly caused this immune response to be taking place so often. And when we see it here, we can already assume that it is chronic, that it's been chronic, that it's not just a one-time thing, or it's not the normal process, but it's actually become a chronic issue. With the next marker here, the DAO, the diamine oxidase, this parameter is actually reversed from what we're used to seeing, where we read from left to right. So in this case, we're going to read it from right to left in terms of low to high, but it still reads the same in terms of we want it to be on the left side. DAO, the DAO enzyme, we want that to be in the higher range rather than the lower, because that means that your body is producing this enzyme that it needs to be able to break apart those histamine bubbles. Now, we don't want it too high, or we want to always look at it in terms of the ratio with histamine production, which is the next marker. In this client's case, the histamine is also in the red, in the fifth quintile here. So they have a reading of 5.2. We want this below 0.6, ideally, so that we know that the body is either developing histamine or it's taking up histamine from the outside world, but it's not overloading or taxing the system. And sometimes it might be in the lower range, but the body is not producing enough of the enzyme. We need to really take a look at that ratio between the two, not just the single parameters. And again, remember, this is just one lab. It's not the entire picture. We want to see how all the labs are communicating with one another, plus taking a look at the clinical correlation, so all the symptoms that the client is experiencing. So when we look at the ratio here, again, it is in the fifth quintile, far right of the index, and it is in the red, meaning that we are not in a good balanced state. That is, the enzyme production doesn't match the histamine response. And so there is much need for improvement here. And there's plenty of things people can do. Remember, diet is so key. So we want to take a look and see, is this person eating a high histamine diet? Is this person chronically under stress? Because stress can also exacerbate the histamine response. We want to look at environmental toxins for sure. Anything that's being applied to the skin, anything that's overloading the system in general will also impact digestion. And the body needs to reserve energy for life-sustaining activities. So when we have additional stressors that are starting to impact our cortisol and then everything downstream, we know that the downstream systems that are not essential to survival they're going to be impacted. And so digestion is one of those things. We need to survive. We need to have enough energy produced to make it from day to day, moment to moment. We need to have that ability to survive, and our digestion will be compromised. That wraps up just a quick look at the mucosal barrier assessment and explanation of what the mucosal barrier is and how it ties into some of the other organ systems. Now, tomorrow, I hope you join us on the Health Detective podcast, because we're going to be talking about mesh implant illness, or Asia syndrome. And that's something that I've experienced personally. So I hold this type of conversation near and dear to my heart. And definitely I am trying my hardest to get that information out there to people who have actually either experienced mesh implant illness, or they're considering getting a mesh implant for a hernia repair. It's just very good to be informed and make sure you have all of the pieces of the puzzle together before you make a decision. Make sure you research, but we'll really go into that tomorrow on the Health Detective podcast. So I believe it's at 11:15 Eastern time. I hope you will join us. I'm looking forward to having that conversation on Health Detective podcast. Thank you for joining us on today's episode. We'll see you next time. Take care.
Don't forget to subscribe to our podcast and also to our Instagram. Our handle is Functionally Enlightened.
Dr. Sharon Surita is not a medical professional and is not providing healthcare, medical, or nutritional therapy services, or attempting to diagnose, treat, prevent, or cure any physical, mental, or emotional issue. The information provided in this podcast is for the informational purposes only and is not intended to substitute professional medical advice, diagnosis, or treatment. Always seek advice from your physician or other qualified healthcare provider before undertaking a new health regimen. Do not disregard medical advice or delay seeking medical advice because of information you heard in this podcast. Do not start or stop any medications without speaking to your medical or mental health provider.